It's about the joints and their movements. It's
Then
biomechanics. Why did we
treated her abdomen for knee joint? This is your question. Now I will ask you questions, you will answer me.
Okay.
So here, for knee joint pain, we treated her abdomen. You will get to know yourself. Knee joint is made of which bone?
Femur and tibia.
Femur, tibia and
Patella.
3 bones?
Yes.
Now just look at the tibia. Tibia is from here till here. If I move this, if I just move this, okay, now this tibia is making which joint?
Ankle joint. Ankle joint.
Ankle joint and knee joint.
Knee joint.
There is no gap here. So if I move ankle, will it affect knee?
Yes.
If I move knee, will it affect ankle?
Yes.
Because this is one. Correct?
Yeah.
And this one thing is attached. Something like this. If I move this, then also knee joint will get affected. If I move this, then also knee joint will get affected. Similarly, if this is femur, this is making which joints?
Hip joint and knee joint.
Hip and knee joint. So, if I move hip, will it affect knee?
Yes.
Either of the one, correct? Now, who is moving these bones?
Muscles.
Muscles. So, you agree we are like puppet?
Yes.
So, you've seen puppet?
Yes, ma'am.
How puppet moves?
With the help of threads.
With the help of threads. Where are the threads? Up or down?
Look at it up.
Up. If you pull the string, then only the movement comes. So that means, if I want to do dorsiflexion, where should be the thread?
Above it.
Above. So very natural that always muscle is above, joint is below.
Yes.
Correct? So now for knee joint pain, where is the muscle?
Above.
For extension?
Quadriceps.
Flexion?
Hamstrings.
Now, but we saw that even this movement will affect knee joint. Now let's see what and all is attached here. What is controlling your upper portion of femur? There are 3 muscles on lesser trochanter. Major muscle is this psoas, which is coming from your diaphragm.
Yes.
And it is also coming from your whole spine. Correct? And that gets attached. This is the only muscle which is attached back and front. It comes and gets attached to your femur. Correct? So, if psoas will pull, this string will pull. What will happen to femur? Femur will go like this.
Yes.
So that will affect knee.
Knee joint.
Now if one side psoas is shortened, other side is lengthened, will it affect knee?
Yes.
Definitely yes. Because it will pull femur also.
Yes.
It will pull ilium also. Correct?
Yes.
So that is why when we have to treat knee joint, we should always be starting from psoas.
Okay.
We'll also be treating diaphragm. And major muscles of knee joints, they are coming from where?
From the pelvis.
From pelvis.
Yes.
Correct? Especially from, if you talk about pubic ramus area, pubic tubercle. Your rectus is also coming from your ilium. Correct?
Yes.
Your pes inserine is coming from your ilium bone. So what does that mean? Ilium is a very, very important part of knee joint. Threads are coming from there. If threads are coming from there, so that means it is not only femur, it is this also.
Yes.
So that is why whenever anybody has got any issue with the spine, they get pain in their knee also. And knee compensates for that. Many a times patient will not complain anything for their back, but they will complain that they have knee pain. So that is why when we started treating her abdomen, her knee was absolutely fine. She said now there is no pain at all. Okay. So whenever you treat any joint, you have to see for the threads from where it is coming. Go till the end. So when you go till end, you will realize that there is no end.
Okay.
So you'll be ultimately, it will track you to facial lines and you will reach to a point where you will find that the causative factor was somewhere else.
Okay.
Okay. Like headache. Sometimes plantar fascia can relieve headache.
Okay.
So it all depends when you track the muscles.
Yes.
So for that you go through facial lines. So whenever you treat somebody, you have to treat them 360 degrees. Okay, we'll just take an example of neck. When you saw 3 patients today, all
Yes.
3 of them, what we did, they came with neck pain, but we treated this area, correct?
Yes.
We treated their clavicle. Why? Because we wanted to make sure that 360 degrees is fine. Why? Now if I take this is anterior, this is posterior, front and back. Now can you tell me what and all organs here you can see laterally? This is anterior. What is this?
Trachea.
Trachea. What is this?
Esophagus.
Esophagus behind trachea.
Yeah.
And behind esophagus is your
Spine.
spine. So in neck, that means you have like this.
Yes.
In front trachea, then comes esophagus, then comes spine. They are like best friends. They are united. Okay. When they are united like this, you cannot separate them. If any issues comes with the spine, even trachea will get affected. If any issue comes with trachea, this will also get affected. And at the same time, esophagus will also get affected. So to release this, you have to make sure that at least you release the fascia 360 degrees. And you've seen the magic today when we treated anterior aspect of their neck. What happened? They all said there is
Yes.
no pain at all. No radiating pain to their shoulder as well.
Yes.
Correct? So similar goes with your lower back also. Whenever there is pain in the lower back, God has gifted us with a natural belt. What is this?
Core.
Core. Core is a natural belt.
Yes.
But mostly females, especially after the deliveries, you will see that they have sagging tummy. So because of that, because they never worked on their abdomen, they're just working on their spine, legs, strength of other things, so they get back pains. But the moment you either hold core, because what happens, similar is the thing with spine. In front of your spine you have abdominal organs. Everything is covered in fascia. Okay, one cell is covered in fascia, then a group of tissues is covered in fascia, then one viscera is covered in fascia, then multiple visceral organs are covered in fascia. So it is like multiple layers of fascia. So that means if one side fascia gets affected or it goes into spasm, it will affect the whole
Body.
abdomen, whole back. So when there is a lower back pain, you will always release abdomen as well.
Okay.
You've already finished psoas, correct? So psoas is the most important thing that comes in front and back both that you have studied. So that is why when you want to treat anything, you will be treating 360 degrees. Like for the doctor, when we treated, we saw that just working on anterior aspect, it didn't work much. It worked, he was 60% better, still 40% pain was there. So what we did, we worked on his posterior aspect as well. Then we did both the things.
Okay.
Okay,
Yes.
so 360 degree is a mandatory thing for treating any case.
Okay.
So what we do here, when we release fascia here near the diaphragm, we see that it is very tight. So what we do, during exhalation we tuck in and we try to lift the rib cage. Similarly we do on the left side. If a patient comes with right side shoulder pain, lifting your right side rib cage will relieve this pain, because your rectus continues with your pectoralis and pec continues with your biceps. Okay, so that relieves your tension. So, and whenever you touch their diaphragm, you will realize that it is so tight. And similarly, when you ask them to place their fingers here in between their last rib and ilium, as per a human being, they should be able to tuck in 4 fingers easily. Every individual's own size. But if they are not able to tuck, that means they are compromising here with this space. So we should make sure that we lengthen this. And this is the area where your quadratus lumborum muscle comes. Correct?
Yes.
So you have to make sure that you lengthen their latissimus and quadratus lumborum. Now the thing is, quadratus lumborum fascia gets attached to psoas.
Okay.
Okay, are you getting this?
Yes.
Let's see how back and front everything is connected.
Okay.
Similarly, behind your lateral raphe also comes. So you have to make sure that you lengthen this area. When you lengthen this area, that helps a lot, and Visceral organs are not compressed, they also start breathing nicely. Now what happens? You know that heart has a rhythm, 72 times average beat. Similarly, you know about lungs. Similarly, we have rhythm for each and every organ, liver, stomach, duodenum. Okay, so everything has got their own rhythm. When they don't work as per that rhythm, like you say, heart rate has gone till 100, 120, it is an alarm. Heart rate is very low, that is an alarm. Similarly, lung respiratory rate has gone above 40, it is an alarm. It is lesser. You are understanding?
Yes.
So similarly, when fascia goes tight, these rhythms go haywire. And you have seen that many patients, female, they come and they say that they are not able to conceive. And when we do mobilization of their uterus area, this pelvic diaphragm region, we find that they are not only relieved, they also conceived. Anybody who has dysmenorrhea, they become fine. What we did? Nothing. We just corrected the rhythm. Similar is anybody having initial grade of fatty liver. That gets corrected just because you are making their machinery to work properly. Back to the original form, which was not working. Correct? You got the rhythm back. See, what you do when your heart rate is high, you ask them to do breathing exercise. Similarly, when you work on the abdomen, automatically diaphragm gets relieved, even heart rate goes down. We have also tried treating by working on visceral organs, their BP goes better instantly. You understood the power?
Yes.
So ultimately what you are doing when patients are asking, we are just telling them that what we are doing is we are just making sure that your machine is working in a natural way on its own without any medications. Correct? On its natural pace, which your by your posture or some things, it has become tight. That is why when they do abdominal tuck-in exercise, it's kind of a massage thing. Like they come and say Baba Ramdev's one exercise, I forgot the name, Kapalbharti. That is not meant for everybody, but if you do that at a slower pace, tucking their tummy in, leaving, so that massages your organs and it makes sure that your machinery is working. Okay, that is the active way of doing. Passive way is what we do with hands.